Interstitial lung disease, or ILD, is a group of lung disorders. These disorders are complex and can vary greatly from one person to another. They are characterized by the involvement of the interstitium, a lace-like network of tissue that supports the air sacs in your lungs. The interstitium is crucial for the proper functioning of your lungs, as it helps in the exchange of gases between the air you breathe and your bloodstream. These disorders affect a part of your lungs called the interstitium. The interstitium is a thin layer of cells that lies between the air sacs in your lungs. It provides structural support and plays a vital role in the transfer of oxygen from the air into your blood. When the interstitium becomes damaged or scarred, it can lead to a range of symptoms and complications. ILD causes scarring and inflammation in the interstitium. This scarring, also known as fibrosis, can thicken the interstitium, making it more difficult for oxygen to pass through. Inflammation can further exacerbate the problem, leading to a progressive decline in lung function. Over time, this can result in chronic respiratory issues and significantly impact your quality of life. This makes it hard for your lungs to get oxygen to your body. As the disease progresses, you may experience symptoms such as shortness of breath, a persistent dry cough, fatigue, and chest discomfort. These symptoms can be debilitating and may worsen over time, making everyday activities increasingly challenging. ILD is a serious condition. It requires careful management and ongoing medical care. The prognosis for ILD can vary depending on the specific type of disorder, the extent of lung damage, and how early the condition is diagnosed. Some forms of ILD can be managed effectively with treatment, while others may progress more rapidly. It's important to understand ILD so you can get the right treatment. Treatment options may include medications to reduce inflammation and slow the progression of fibrosis, oxygen therapy to help with breathing, and pulmonary rehabilitation to improve lung function and overall fitness. In some cases, a lung transplant may be considered for patients with advanced disease. Early diagnosis and management are key to living well with ILD. Regular monitoring and follow-up care are essential to track the progression of the disease and adjust treatment plans as needed. By working closely with your healthcare team, you can take proactive steps to manage your condition, maintain your quality of life, and stay as healthy as possible. Imagine your lungs like a delicate sponge. This sponge is not just any ordinary sponge. It is a marvel of biological engineering, designed to facilitate the essential process of breathing. Each breath you take fills this sponge with air, allowing life-sustaining oxygen to enter your body. The lungs are composed of millions of tiny air sacs called alveoli, which are the primary sites for gas exchange. These alveoli are surrounded by a network of blood vessels, creating a highly efficient system for oxygen to enter the bloodstream and carbon dioxide to be expelled. The interstitium is the framework of this sponge. It is a delicate, lace-like network of tissue that supports the alveoli and blood vessels. This framework is crucial for maintaining the structure and function of the lungs. The interstitium is composed of a variety of cells, including fibroblasts, which produce collagen and other proteins that provide strength and elasticity to the lung tissue. It also contains immune cells that help protect the lungs from infection and injury. It's the space between the tiny air sacs, or alveoli, and the blood vessels. This space is incredibly thin, allowing for the efficient exchange of gases. Oxygen from the air you breathe diffuses through the walls of the alveoli and into the blood vessels, where it is carried to the rest of your body. At the same time, carbon dioxide, a waste product of metabolism, diffuses from the blood vessels into the alveoli to be exhaled. This process is vital for maintaining the balance of oxygen and carbon dioxide in your body. Oxygen travels through this space to reach your blood. The efficiency of this process depends on the thinness and integrity of the interstitium. Any disruption to this delicate balance can have serious consequences for your health. For example, if the interstitium becomes thickened or scarred, it can impede the flow of oxygen into the blood and the removal of carbon dioxide from the blood. This can lead to a variety of respiratory symptoms, including shortness of breath, coughing, and fatigue. ILD disrupts this vital exchange. Interstitial lung disease, ILD, is a group of disorders that cause inflammation and scarring of the interstitium. This scarring, known as fibrosis, can make the interstitium thick and stiff, reducing its ability to facilitate gas exchange. ILD can be caused by a variety of factors, including exposure to environmental toxins, certain medications, autoimmune diseases, and infections. In many cases, the exact cause of ILD is unknown. When the interstitium is inflamed and scarred, it becomes thick and stiff. This thickening and stiffening of the interstitium can make it difficult for the lungs to expand and contract, leading to a decrease in lung function. Over time, this can result in chronic respiratory failure, a condition in which the lungs are unable to provide enough oxygen to the body or remove enough carbon dioxide. This can have a significant impact on a person's quality of life, making it difficult to perform everyday activities and increasing the risk of complications such as infections and heart failure. This makes it harder for oxygen to pass through. As a result, people with ILD often experience shortness of breath, especially during physical activity. They may also have a persistent dry cough, fatigue, and chest discomfort. In severe cases, ILD can lead to respiratory failure, a life-threatening condition that requires immediate medical attention. Treatment for ILD typically involves medications to reduce inflammation and slow the progression of fibrosis, as well as oxygen therapy to help improve breathing. In some cases, a lung transplant may be necessary. Early diagnosis and treatment are crucial for managing ILD and improving outcomes for patients. The most common symptom of ILD is shortness of breath. This usually happens gradually, worsening over time. You might notice it first with exertion, like climbing stairs. Another common symptom is a dry cough that doesn't produce phlegm. Other symptoms can include fatigue, unexplained weight loss, and chest discomfort. It's important to see a doctor if you experience these symptoms, especially if they persist. Diagnosing ILD, or interstitial lung disease, involves a combination of tests and evaluations. This process is crucial because ILD encompasses a group of disorders that cause scarring of lung tissues, which can affect your ability to breathe and get enough oxygen into your bloodstream. The diagnostic journey begins with a thorough assessment by your healthcare provider. Your doctor will first take your medical history and perform a physical exam. This initial step is vital as it helps the doctor understand your symptoms, lifestyle, and any potential exposure to environmental or occupational hazards that could contribute to lung disease. They will ask about your medical history, including any previous illnesses, surgeries, and medications you are taking. During the physical exam, they'll listen to your lungs using a stethoscope to detect any abnormal sounds, such as crackles, which can indicate lung scarring. They will also check your oxygen levels using a pulse oximeter, a small device that clips onto your finger. This helps determine if your blood is carrying enough oxygen, which is essential for your organs and tissues to function properly. Pulmonary function tests, or PFTs, are a series of breathing tests that measure how well your lungs are working. These tests are non-invasive and provide valuable information about the capacity and efficiency of your lungs. They help in assessing the severity of lung impairment and monitoring the progression of the disease. During these tests, you will be asked to inhale and exhale into a mouthpiece connected to a machine. The tests measure the amount of air you can inhale and exhale, and how quickly you can do so. This includes tests like spirometry, which measures the volume of air you can forcefully exhale in 1 second, and lung volume tests, which measure the total amount of air your lungs can hold. Another important test is called a DLCO test, or diffusing capacity of the lung for carbon monoxide. This test measures how well your lungs transfer oxygen from the air you breathe into your bloodstream. It involves inhaling a small amount of carbon monoxide, holding your breath for a few seconds, and then exhaling. The amount of carbon monoxide absorbed by your blood is then measured. The DLCO test is particularly useful in diagnosing ILD because it can detect early changes in lung function that might not be apparent on other tests. It helps in understanding how effectively your lungs are transferring oxygen, which is crucial for your overall health and well-being. Imaging tests like chest X-rays and CT scans are also essential tools in diagnosing ILD. Chest X-rays can provide a quick overview of the lungs and can detect obvious abnormalities, such as scarring or fluid buildup. However, kinetic scans offer a more detailed view and can reveal subtle changes in the lung tissue that might not be visible on a standard X-ray. These imaging tests help visualize the lungs and look for abnormalities, such as fibrosis, nodules, or other structural changes that are characteristic of ILD. In some cases, your doctor may recommend a bronchoscopy or a lung biopsy to obtain a tissue sample from your lungs. A bronchoscopy involves inserting a thin, flexible tube with a camera into your airways to examine the lung tissue and collect samples. A lung biopsy, on the other hand, involves removing a small piece of lung tissue for examination under a microscope. These procedures can provide definitive information about the type and extent of lung damage, helping to guide treatment decisions. After all the tests and evaluations, your doctor will discuss the results with you and explain the next steps. This may include further testing, treatment options, and lifestyle changes to manage your condition. It's important to have open communication with your healthcare team and to ask any questions you may have about your diagnosis and treatment plan. Early and accurate diagnosis of ILD is crucial for managing the disease and improving your quality of life. Remember, you are not alone in this journey. Your healthcare team is there to support you every step of the way, providing the necessary care, education, and emotional support to help you manage your condition effectively. With the right approach and timely intervention, you can lead a fulfilling life despite the challenges of ILD.